Ever wondered why a laryngeal mask airway, or LMA, is vital in anesthesia practice? This simple yet essential tool is a game changer in the field of anesthesiology. It's not just a tube, it's a lifesaver. Today we'll explore its importance, the absolute and relative contraindications, when and how to use it, and even what to do when things go awry. It's all about making the right choices at the right time. So are you ready to delve deeper? Stay tuned as we delve into the world of LMA. Let's start by understanding absolute contraindications of LMA. An absolute contraindication refers to a situation where a particular treatment or procedure should not be used because it may be harmful to the patient. In the context of laryngeal mask airways, or LMAs, there are a few key situations that fall under this category. One of the most significant absolute contraindications is when a patient is at risk of aspiration. Aspiration refers to the inhalation of foreign material into the lungs, which can lead to serious complications. If a patient has a full stomach or is suspected of having gastroesophageal reflux disease, using an LMA could increase their risk of aspiration. Another absolute contraindication is a blocked airway. If a patient's airway is obstructed, perhaps due to a tumor, trauma, or severe infection, an LMA may not provide adequate ventilation. In such cases, an alternative airway management device would be a more appropriate choice. Remember, these aren't the only situations where an LMA is contraindicated. It's always important to assess each patient individually, considering their medical history, current health status, and the specific circumstances of their case. Absolute contraindications pose a high risk, hence it's crucial to avoid LMA use in such scenarios. Understanding these contraindications will help ensure that you're making the safest, most effective choices for your patients. Relative contraindications, on the other hand, are a bit of a gray area. While absolute contraindications are clear-cut cases where using a laryngeal mask airway or LMA is a no-go, relative contraindications are less black and white. Let's take obesity as an example. Some argue that obesity increases the risk of aspiration, and therefore, the use of LMA should be avoided. However, others point out that if managed properly, an LMA can be safely used in obese patients. Another debated area is pregnancy. The physiological changes during pregnancy, such as increased oxygen consumption and decreased functional residual capacity, can make airway management challenging. Still, many practitioners have successfully used LMA in pregnant patients, especially for short procedures. Prior upper respiratory infections are also a point of contention. On one hand, these infections can cause airway inflammation and increase the risk of airway obstruction or bronchospasm. On the other hand, with careful monitoring and appropriate medications, these risks can be managed. In the end, the use of LMA in these situations is not a hard and fast rule. It requires careful consideration of the patient's overall health status, the nature of the procedure, the anesthesiologist's expertise, and the availability of alternative airway devices. Indeed, the world of relative contraindications is a complex one, filled with shades of gray rather than stark black and white. In these situations, the decision to use an LMA should be determined on a case-by-case basis. So, when exactly should an LMA be used? Well, that's a great question, and one that's essential to understand for ensuring patient safety and procedural success. A laryngeal mask airway, or LMA, is often used in situations where the use of an endotracheal tube may be unnecessary or challenging. For instance, in short surgical procedures that require general anesthesia but don't involve the respiratory tract, an LMA can be an ideal choice. It's less invasive than an endotracheal tube, which can make the patient's recovery smoother and more comfortable. Another situation where an LMA is indicated is when the patient is expected to recover spontaneous breathing rapidly. This is often the case in ambulatory surgeries, where the patient is expected to go home the same day. Here, an LMA can facilitate a quicker recovery and discharge. Furthermore, an LMA can be a lifesaver in emergency situations where intubation is not possible. For example, in a difficult airway scenario where intubation attempts have failed, an LMA can be used as a bridge to secure the airway temporarily. Lastly, an LMA can be used in patients with a known difficult airway, where intubation could pose a risk. This is usually determined preoperatively based on the patient's anatomy and medical history. However, it's important to remember that while an LMA has its advantages, it's not suitable for all scenarios. Understanding its indications and contraindications is key to its safe and effective use. Knowing when to use an LMA is crucial for patient safety and procedure success. Choosing the right LMA can make all the difference. The choice of a laryngeal mask airway isn't a one-size-fits-all decision. It's a nuanced process that requires considering multiple factors. One of the first things to consider is the patient's size. Pediatric patients will require smaller LMAs, while larger adults will need bigger ones. The type of procedure also plays a significant role. For shorter, less invasive procedures, a standard LMA might be sufficient. However, for longer procedures, or those involving positive pressure ventilation, a reinforced or flexible LMA may be more appropriate. The patient's health status is another key consideration. For instance, a patient with a known difficult airway or a history of aspiration might benefit from a specific type of LMA that provides a higher seal pressure. Remember, the aim is to ensure the highest level of patient safety and comfort during the procedure. The right LMA can make the procedure smoother and safer for the patient. Now, let's move on to the correct usage of an LMA. LMA insertion is a meticulous process, and it starts with a crucial step: choosing the right size of LMA for your patient. Once you've made the right choice, you can begin the process of insertion. Firstly, deflate the LMA cuff completely. Lubricate the posterior surface of the LMA, but be wary of applying lubricant to the anterior surface or the airway tube, as this could lead to misplaced insertion. Next, hold the LMA like a pen, with the index finger resting on the junction of the cuff and the airway tube. This grip aids in control and stability during insertion. Now ask the patient to open their mouth wide. With the other hand, use a jaw thrust maneuver to open the airway and insert the LMA along the hard palate, sliding it downwards and backwards along this path. As you progress, rotate the LMA until it sits in the hypopharynx. Once in position, inflate the cuff. Here, it's important to inflate just enough to create an effective seal, but not so much that it causes discomfort or potential trauma. Now it's time for a crucial step: patient monitoring. Connect the LMA to a breathing circuit and check for effective ventilation. Look for chest movement, listen for breath sounds, and monitor the capnography. Remember, the key to successful LMA insertion is practice and patience. If the LMA doesn't sit right initially, don't force it. Instead, deflate the cuff, remove the LMA, and try again. If you still encounter difficulty, it may be necessary to consider other airway management options. As you can see, correct positioning and patient monitoring are crucial aspects of LMA use. These elements not only ensure effective ventilation, but also minimize the risk of complications such as aspiration or trauma. Following these instructions can ensure effective airway management and reduce complications. So remember, choose the right size, insert carefully, position correctly, and monitor your patient. These simple steps can make a significant difference in patient outcomes. Even with proper usage, sometimes things can go wrong with an LMA. Firstly, let's talk about a common issue: poor seal. This can be caused by a variety of factors, including incorrect size, improper placement, or insufficient cuff inflation. To troubleshoot, start by ensuring you've selected the right size for your patient. If the problem persists, reposition the LMA, making sure it's properly aligned with the patient's airway. Lastly, verify that the cuff is adequately inflated. Next, we have blockages. These can occur when the LMA is obstructed by secretions, blood, or even the patient's tongue. To clear a blockage, you can try suctioning the airway, repositioning the LMA, or in some cases, replacing it entirely. Remember, it's important to remain calm and composed to ensure the safety of your patient. Dislodgement is another hurdle you may encounter. If the LMA moves out of place, it could compromise the airway. Signs of dislodgement include changes in capnography, difficulty ventilating, or a sudden increase in airway pressure. If you suspect dislodgement, immediately remove the LMA and reinsert it, paying close attention to correct placement. While these are common problems, it's also essential to be aware of less frequent issues such as cuff leaks or damage to the LMA. If you suspect a cuff leak, try reinflating the cuff. However, if the leak persists, replace the LMA. For any visible signs of damage, it's best to replace the LMA immediately to avoid any further complications. Remember, the key to troubleshooting is maintaining a clear thought process and systematic approach. Don't rush, as this can exacerbate the situation. Take a moment to assess the situation, identify the problem, and then move forward with your action plan. Finally, while we hope these issues don't arise, it's crucial to be prepared. Regular practice and familiarity with the LMA and its potential problems can make all the difference when it comes to patient safety. Being prepared for these situations can help you quickly resolve issues and ensure patient safety. So, that's a wrap on our deep dive into laryngeal mask airways. We've covered the absolute and relative contraindications, helping you discern when it's not advisable to use an LMA. We've also touched upon the key indications for LMA use. The importance of selecting the right LMA was emphasized, as well as the essential steps in troubleshooting. This comprehensive understanding is vital for any anesthetic practice. With this knowledge, you are better equipped to ensure safe and effective use of LMA in your anesthesia practice.